going to do a bit of a Q&A, but first, if you'd like to just tell us a little bit about the film and your work that led that is.
Well, this film was made about 2 years ago, I believe, and these are real patients that came to see me. The gal that you saw in the last feature was a girl I met around the age of 22, like 45 years ago, and I bumped her into her in the street in New York. I said, "Hey, would you like to participate in this film?" She said, "Yes." So that's the second person in the film. Bipolar patients are totally different from the schizophrenic patients that you saw also on the several films tonight. At the turn of the century, were in the same basket as the schizophrenics. And by 1950, all American psychiatrists were calling any mental illness schizophrenic. A taste of schizophrenia is schizophrenia. So when I came upon the scene, way back in 1958, the psychopharmacology revolution was just beginning. The first revolution started way back in 1700 with Canel freeing the patients from chains and hot water baths, cold icing baths, which had gone on since Socrates' times, when they did bloodletting and ducking people's heads in water to cure their psychosis. So then along came Freud in the 1900s, first Pinel in the Paris hospitals, freed the patients from the chains. Then came Freud, 1900, he said all these psychoses are treated by psychotherapy and psychoanalysis. So that went on for the first 50 years in America and around the world. I came upon the scene in 1958, I was a resident up in Columbia, and the psychopharmacology revolution, the third revolution in psychiatry, was just beginning. 2 or 3 drugs were studied, and I started out my psychiatric residency at Columbia, and about 8 months through, I went up to the director, Dr. Kolb. I said, "I don't think I like this field. I've been trained in internal medicine, and these people are all talking and looking at each other, asking each other questions. I want to go back into medicine." He said, "Ron, I just came back from Australia. I met a guy by the name of Cade. He's starting to work on a drug called Lithium. Why don't you stay a while and try and get into the medical side of psychiatry?" So I stayed another 40, 50 years. Anyway, the whole career that I embarked on at that point was bringing lithium into American psychiatry, and it was specific for bipolar disease. We started our first trials up at Columbia, and by God, these people that were psychotic, looking like schizophrenic, but really manic depressive, all evened out in 10, 15 days. Miraculously, they were able to leave the hospital for the first time. So I saw this incredible sight, and I've stuck with it all my life. And today, as 40, 50 years later, lithium is still the most specific treatment for bipolar illness. The problem is that lithium started getting a bad name because you can't make any money with it in the pharmaceutical industry. It's non-patentable. It occurs in rocks, it occurs in mineral springs, and you just can't patent it. So even though it is still the most specific drug in psychiatry for any specific mental illness, it is not very well thought of by a lot of people because the pharmaceutical industry has taken a very negative public relations approach to it. Anyway, I'm still treating many, many bipolar patients that have been with me 20 and 30 years. They're able to go about their totally normal lives once they're therapeutically in the right range of lithium. And the interesting thing that I've been working on the last 10 years is that some of our world leaders and outstanding people, particularly in the creative arts, have bipolar illness. And the bipolar form, that is the milder form called bipolar 2. Many of these people are our leading achievers around the world. For instance, there's a book out on Clinton. He's bipolar. You know, who would dare having sex in the Oval Office and run the country? That's Clinton. These people are hypersexual, they're hyper-energetic, they don't need to sleep. Take a look at Churchill, his days of running the war. He had black days, well documented, when he'd sit staring into space for 2 weeks, then suddenly come out, energetic, running his generals at midnight, going down to get the London Times, generals all flaked out, tired. Then he ran the war, or won the war. This is the kind of guy that is in the milder form of bipolar called bipolar 2. The psychotic bipolars go into the hospital with a wild manic psychosis, but the bipolar 2s have the depression, but they have a lighter form of mania that enables them to achieve. So just take a look at the New York Times the other day. Putin, gets late for his meeting with Merkel, stands her up. Next thing we know, he's having truffles, 4 o'clock in the morning with Berlusconi, the ex-president of Italy. So you got Putin and Berlusconi. They don't need to sleep. Clinton doesn't need to sleep. This is characteristic of the milder form of bipolar. I like to call it bipolar beneficial because it helps you get on in life. The top Wall Street traders, the top doctors, the top lawyers, the top anything probably have a bit of the bipolar in it. But it doesn't go so far that they have the bipolar psychosis. In the families of all bipolar people, you're going to find alcoholism, depression, suicide, but outstanding achievement. Most bipolars don't need more than 4 or 5 hours sleep. They do well in that. But if you get a little higher, it's 2 hours and 1 hour and 3 hours and no sleep, and then you may go into the psychotic form. Anyway, lithium is the drug that specifically treats this. And in the meantime, since the pharmaceutical industry got into this, they produced a number of Me Too drugs, but they're not really Me Too. They're different chemical makeups, but they do work, but they're not as efficient, and they leave a lot of side effects. I'm talking about drugs like Depakote, Lavicto, carbamazepine, and so forth. So there are other drugs to treat bipolar today. Each one of these drugs brings in $4 billion a year for the pharmaceutical industry. Lithium brings in nothing. It's manufactured by several companies, but as a token to the drug industry. So that's just a little chapter that I'm willing to give some ideas on. And then if anyone have any questions, I'm happy to ask you. But all these shows tonight, I would say, are outstanding. Just absolutely outstanding. Delighted to be here.
Thanks for that fascinating introduction to your film then, too. But before we move on to questions, if you'd like to say a little bit about your film.
Can I sit down?
Oh, sure,
You
yes.
always sit down?
Or you can stay if you'd like to answer questions.
Kind of impressed because my film description would be as follows.
Impressiveness. So I think this is still the case, but I know that I think if someone is below the age of 18, you're still not allowed to diagnose them. I think you can only diagnose in terms of depression. Or so my question is, I know that primarily it's the easiest to detect that once someone is over the age of 20. I think it's different for men and women. But do you have an opinion on diagnosing that before 18? Have you had to deal with that before? Anyone who came in, you clearly knew that was their problem, and you weren't really allowed to diagnose them for legal reasons?
The question is, have you encountered the problem that due to brains still developing during teen years, sometimes it's considered bad to diagnose certain disorders or to prescribe medication for them under the age of 18? Is that something that is a concern with lithium, or have you run into this?
It's a bad approach to prescribe psychiatric medicines to anyone unless you've given a thorough opportunity to explore every other route possible. And I'm talking about psychotherapy, and I'm talking about counseling, college in particularly. You try other methods first before you come to the conclusion that the person needs medication. But in the case of depression, we're talking about biological depression. Biological depression is 4 to 6% of the world's population. This is a medical illness. It's a metabolic illness. It comes inherited through the brain. So when you see it, you know it instantly. It's hopelessness, helplessness, worthlessness, suicidal feelings, weight gain, weight loss, oversleeping, undersleeping. This little picture of 5 or 6 symptoms doesn't occur in neurotic people or people that just have a temporary loss in their life or in bereavement. It occurs in this biological type of depression, And the twin sister of that is bipolar. It has the same symptoms of the depressed phase, but the bipolar phase is no need for sleep, overactive, overtalkative, hypersexual, on top of the world, life of the party, overspending, credit card speeding up, and so forth. You see that right away, and you know what you've got. So you usually don't say, well, take a year off and get some psychotherapy. You get a medical exam to know they're medically healthy, and then you offer this treatment.
But I mean, below the age of, if someone is 18 or under, I'll just, sorry.
Here.
But my main question is, when someone is under 18 or younger, aren't you, by law, not allowed to diagnose them, even if you clearly see those symptoms? For bipolar, don't you specifically have to be above 18 to actually prescribe lithium? So I was wondering, when, if it's very clear that they have those symptoms, what would be the protocol, I guess, if you are not legally allowed to prescribe them?
Well, this is the first time I've ever heard you can't diagnose or prescribe
maybe I'm wrong.
medication to someone under 18. I've never heard that
I thought you
before.
couldn't treat bipolar or like specifically say.
There's a massive world literature in 5 or 10 languages on the diagnosis of bipolar and the treatment of bipolar children going back to age 6, 7, 8, 9, 10. I think they're probably overdiagnosed, like certainly ADHD is overdiagnosed. That's the case of all mental illness, I think, in children and adolescents. So you've got to be very, very careful about that. But there's no legal reason they can't diagnose it or give the treatment. And if they have a real thing, if there's a heavy bipolar family history, and the boy or girl shows up, with the same symptoms in child or early adolescence, chances are the correct thing to do after they're in therapy for a while is to give them the medication, and that is legal as far as I'm concerned.
Other questions from the audience? Right there.
Hi, I have another one for the doctor for bipolar. For bipolar 2, can you use lithium? And also, how do you know if somebody, for example, they have a zest for life, they're, let's say in New York, they like enjoying different things, a few times a year they'll study all night or they'll go out all night, or it's a minority of times. They're in college or they got a divorce, they're promiscuous for a small period of time, they run up a credit card bill, debt, but they pay it back. Like, how do you know when it's actually like too much diagnosing and labeling, or it's just you're having fun, you're going on one shopping spree?
I know the exact answer to that question.
Okay.
They will never come to see me. They're happy. They come if the credit card one day goes to $100,000 and the police bring them in and they're in bankruptcy. Then they come to me. But if they're having that little fling and buying a few extra dresses, a few little extra jewelry twice a year, get in a little trouble, they're not going to come to see me.
Unless their confidence is down and they're hypochondriac and going through a little sadness, not depression, or they're doubting themselves or something like that.
Well, if they come to see a psychiatrist and they're coming in for personality disorder, problems with self-esteem, confidence, and that sort of thing, I'll say, look, I don't think this person is ready for medication. See Dr. M in my office, who's a psychotherapist, and work with that person for a while. And if he and you both together think this is getting out of control too often, we can always give you a little medication.
Other questions? Yeah.
I was just wondering if you could comment on the idea, I believe it was the first woman in film, she had sort of the perspective that her condition, and it seemed like it was probably a more severe version of the condition, was almost a gift in the way that it allowed her to think about things and experience the world. And I was wondering what your opinion on the idea of a severe condition like that as a gift.
That gal was a beautiful, beautiful, striking 25-year-old a number of years ago. She had multiple psychotic, manic episodes requiring hospitalization. In the beginning, before she came to see me, she was getting all other kinds of drugs that were not specific for bipolar, like Thorazine was the main drug of the 1950s before lithium really took over. So she came in with 5 psychotic hospitalizations. and putting her on lithium, she stabilized off and had a wonderful lifetime career.
I think the question was also about one of the other films where there was the girl giving the monologue who I believe had Crohn's disease.
So that,
The girl in the third or fourth film, I think, who had Crohn's disease, and she was delivering this monologue, and she sort of was trying to see the bright side of it in a way and say, oh, maybe there's these better aspects of it. I can imagine that this is transforming me somehow or making me better.
okay, here you have a situation where you have a medical illness and the reaction to a medical illness. That's called a reactive depression. There, usually the principal approach is sending the person to a psychiatrist or a psychologist that is going to talk about this illness. Now, in some cases, antidepressant drugs help, but they are a secondary tool in the treatment of this person. The most important thing with a reactive depression, loss of a loved one, loss of finances, loss of your own health through medical illness, that type of depression is best treated with psychotherapy, as good as psychotherapy is today. Psychotherapy could be talking to a friend, talking to a minister, a priest or a rabbi, or going to a psychologist or a social worker or a therapist. But that's the best way to treat the despondency from having a medical illness. Antidepressants help, but only as a secondary feature.
I have a question for both of you, actually. Both your films are obviously very different, but they're both films. I always, when I'm programming these things, think about how the style of film, it complements the material, and if you could speak about how the editing and just the way the film that you were in was arranged, how that struck you, and also how you put together the sort of mood of your film and the way that's put together. So what were your thoughts on the finished
I
product?
had nothing to do with the editing of the film. The person who edited the film was supposed to be here tonight and got sick.
But what did you think when you saw it?
I didn't realize I looked that old. I think it was edited very well by the people behind the scenes that handled the entire film itself, because all that I was involved with was, as you saw it, I was being interviewed at the office and in my home. And they didn't have, the one thing is that they had me looking without speaking, and then they had a picture of me, a still picture of me, and then speaking came on the side. That's not natural. I should be speaking. I should be good at speaking. So if I edited, I would have been speaking instead of just looking like this and speaking.
Great. Any other questions? Yeah, right there.
I was. Oh, okay, sure.
I have a question for the doctor. So you mentioned like the $100,000 credit card bill. I don't know if that was offhand, but what are some of the most extraordinary things that you've seen people do
Okay,
whenever
Buzz
they're...
Aldrin went to the moon.
No, besides, yeah, I understand that.
Do you know what happened afterwards?
All right, what?
He got shock treatments. He's bipolar.
Right.
Did
But in your practice...
you ever hear of Hughes, Howard Hughes? You're too young to know about him? Howard Hughes?
Right, yeah.
Yeah.
One of the billionaires of this country. He wanted to watch cowboy movies 6 o'clock in the morning. They wouldn't let him. He bought the station, $5 billion. This is what guys like that do.
Okay.
Ted Turner,
Right.
he won America's race. That wasn't enough. He got bored. He invented CNN. These are the high bipolars, the high flyers that I'm talking about in my latest book called Bipolar 2 or Bipolar Breakthrough. These are the kind of exciting people that have a bit of this illness and not the serious part of it.
Right.
Now they can go too far too. They can cause major fraud in Wall Street. I used to have 2 limousines coming down to the office. The guys would be coming out of there. They just made the Times. They'd been indicted, going to prison because they defrauded the government out of $10 billion, and they're trying to get a psychiatric label on it. And of course, they did have bipolar. So these are a lot of strange stories like that that I've seen over the years.